the pain. Just like what the patient has mentioned, it's just a mild pain. It's just a mild pain. 1 to 3, mild pain. 4 is to 7 is moderate, and severe is 8 to 10. So, since
What
he
have you
said,
done? What have you done in order for you to get that goal? The patient doesn't have 0 over 10, right? So what have you done?
so what we have done is the intervention was followed, ma'am. So we have assessed the characteristic of the pain.
You will just assess, and then the patient is the pain is gone.
No, I think Ma'am
Wait.
Hannah is asking about what did you do to the patient so that the pain relieves?
Okay. So what we have done, ma'am, is of course with the help of the doctor, the medication, we have the aspirin. It is a pain reliever, right?
Okay. I
So-
don't know. Right? I don't know. Okay, pain reliever. Aspirin is
Aspirin
pain
is a pain
reliever.
reliever.
There is a component also of that aspirin as a pain reliever
Yes.
and
Anticoagulant.
anticoagulant. Okay. So good. Only?
That's it.
That's all? Pain reliever? What that pain relieving, giving pain reliever is what? What nursing intervention? You have 2 or 3. Ruwaida. What kind of intervention is that? Ruwaida, look at me. 1, 2, 3. You have.
Yeah,
It's there in your guides.
monitoring the vital sign and to
No. Giving pain reliever is what kind of nursing intervention is that? Can discuss it earlier.
You have 3 kinds. What kind of nursing interventions?
He mentioned it there in your slides. How come you are doing that without knowing your... Ruwaida, we will not proceed unless you will answer me. You're giving medication to your patient in order for him not to feel the pain. Am I right? From 3 over 10, it becomes 0 over 10. Giving medication, what kind of intervention is that? I'm asking what. Yes, Miss B?
Independent nursing
Very good.
and collaborative.
No, yes, collaborative.
And
Yes.
And what's the other one?
What's the other one? Ruwaida, the other one.
independent.
Yeah.
Dependent.
Dependent.
Dependent. Okay? You read the limbs, lines. It is not lines, it is limbs. Okay, limbs. You're, okay? Limbs.
independent and dependent nursing.
And collaborative. Yes.
Collaborative.
Okay, very good. Next.
My question is regarding the NCP. What are the kind of three problems that you presented?
3 problems are
Yeah,
acute
but-
pain. We have pain.
Yeah.
We have activity intolerance
Intolerance.
and ineffective tissue perfusion.
Okay. From your perspective, since you are a nursing grade, in the planning stage, it is only a must for us to. It's also a must for us to prioritize the things for our patient. With the 3 problems that we presented, what will you prioritize?
Thank you so much for that wonderful.
I want person to answer.
Yeah, we will one by one, so it's better. So we can assess.
Kasi ikaw na lahat eh. NCT. You presented 3 NCT. No? You have the activity intolerance, you have pain, and what's the other one? Ineffective tissue perfusion. From your perspective, what will you prioritize for your patient? For the three choices, what's the 1, 2, 3? Give me your priority. If you will be the caregiver or the nursing aide for this patient, there are three problems. The problem is pain, activity intolerance, and ineffective tissue perfusion. What will be your priority? Pain, then? Yeah, it's okay. Pain, what else? Pain, tissue perfusion, and activity intolerance. Perfusion, then activity intolerance. Okay, that's your perspective. Okay. You, what will you prioritize, Cecilio? If you activity intolerance first, and then pain. Come to think of this, you will be dealing with patients. What will be priority? What is your priority? Okay, for this patient. The problem of your patient is pain, perfusion, and activity intolerance. Ano ang uunahin mo? What will you prioritize to your patient?
Pain.
Pain,
Activity.
activity intolerance, and
The last one.
the last, are you sure? Pain, activity intolerance, and tissue perfusion? Okay, Ruwaida, what will be your priority?
Tolerance.
What's tolerance? Lactic intolerance.
Activity tolerance.
Activity intolerance?
This one.
Ruwaida, come to think of this. Your patient has three problems. May tatlong problema ang pasyente mo. The first problem is pain, activity intolerance, and ineffective tissue perfusion. What will you prioritize? When we say prioritize, ano ang uunahin mong i-address sa patient mo?
Pinaka-importante.
What is the essential? What is the important?
Activity tolerance.
Are you sure? Activity intolerance, then
Pain.
pain,
And the last one, perfusion.
perfusion. Emily, what's your priority? You have three problems. I don't want to repeat.
The first is activity and tolerance, and
Okay.
then pain,
Pain. The pain and tissue perfusion.
hindi pala sir.
Again.
First is
Tissue perfusion.
yes, and then activity and tolerance. Pain,
Okay.
and then
Pain and?
activity and tolerance.
Again?
Activity and tolerance.
Again, what will you prioritize?
First,
Tissue perfusion.
tissue perfusion, activity and tolerance. No, wait.
Again, fix yourself.
Diyos ko, kami lang to. Wala kayong ano.
Hindi ako sa ulit ko.
No, walang to.
Hindi po sa yung tanong po.
What will you prioritize here?
Perfusion and tolerance.
Perfusion.
Perfusion and pain.
Pain.
And then activity and tolerance.
Please, his name.
Perfusion.
Perfusion lang talaga. Ineffective tissue perfusion. Kinds of tissue perfusion.
Ineffective tissue perfusion.
Okay.
Pain.
Okay.
And
You have the same answer.
yes, sir.
You. Teresita.
Perfusion.
Perfusion. Ineffective tissue perfusion.
Yes. First pain.
Okay, again, give me your answer.
Perfusion.
Okay, ano talaga muna? Perfusion?
Perfusion or pain?
Perfusion or pain?
You have three.
No,
It
pain.
means na
Oh,
dili mo.
Pain.
Yeah, pain.
And then
Perfusion?
the
And
perfusion is the tissue is number 3.
give me your answer.
Pain.
1, 2, 3. Pain,
Activity of
activity intolerance,
Tolerance
then
and-
pain. Since you are the one who created and presented the NCP, what's your priority?
Well, I was actually torn between
Two lovers.
pain and activity perfusion, but with
Ano? Activity perfusion?
tissue perfusion,
Okay.
ineffective tissue perfusion. However, if you come to think of it, you need to address what's the root cause of the problem. So I will address first the ineffective tissue perfusion, then pain, and then activity intolerance. Why? Because if you will address this ineffective tissue perfusion first, wherein this actually where the pain comes from,
Yes.
and why the patient cannot tolerate to do his daily activities.
Yes.
So if you will address this, everything will go smooth.
Are you sure?
I guess so.
Going back on the pathophysiology, what is the primary problem of your patient? Ken, Ems, and Isleen did well. For me, it's the best answer for me. You need to prioritize physical perfusion, good rationale as well, Ken. Going back to the pathophysiology. Okay, what's the pathophysiology talks about? What's the pathophysiology talks about? Diba? It says that there is an formation of atherosclerosis. Actually, atherosclerosis is gradual. Okay? After you have your atherosclerosis for a long time of period, it will develop what? Ischemia. Then if there will be ischemia, what will happen? Hypoxia. What's the meaning of hypoxia? Provider. What do you mean by hypoxia? Hypoxia. Now, what's the definition of hypoxia?
Reduce oxygen deficiency.
When there is a
So why do you
reduced
answer? Oxygen.
oxygen what? Oxygen. Hypoxia is oxygen, very good. Is it low or low? High?
No.
Why? Why there is a hypoxia? Why there is a hypoxia, Christian?
Kasi yung
Why?
hypoxia is decrease the oxygen to the
I know. It's a decrease of oxygen. Why? There is a decrease of oxygen. In the anatomy and physiology, which area in your heart there is an ischemia? In the anatomy and physiology. Yeah, where is ischemia applied? Which vessel? Vessels.
blood vessel.
Which blood vessels? There's an ischemia. What do you call that one? You presented. The circumflex, what's that?
Give it to you. It's there.
It's there.
It's there.
What's a blockage in the heart? It's your?
It is in right and left.
Yes, right and left. It's a forget
What
from
I
Ara.
The one I give you.
You presented it.
Presented it.
You presented it.
Yes, yes, yes.
What?
What is that?
Yes.
And the right and the left coronary
Okay.
arteries.
That's the coronary arteries. Where the blockage of thrombus or the ischemia comes from. That's why there is an hypoxia or ischemia to atherosclerosis. Then ischemia, hypoxia. Then it will lead to thrombosis. No, not yet. What is thrombus? What's thrombosis? What? Amy, what's thrombosis?
Formation of the
Very good. Formation of what?
Yeah.
Dancers? What?
Formation of
Formation
the
of?
artery or vessel.
Formation of?
yes.
For the arteries.
Formation of what?
Coronary arteries.
Formation of blank into the coronary arteries. Ano yung blank na yun?
Blood.
Blood?
Blood clot.
Clots. Very good. There you go. If there will be a thrombosis, there is a permanent, there is a permanent occlusion in your coronary artery. Succeedingly, is this what will happen? What will happen if there is a thrombosis? There is a, what do you call this one? The second to the last. No, it's the first
That's
one.
the first one.
What? In pathophysiology, it's your, what? What? What's this?
Esophagus.
No, neck, this is neck. What's that? What will happen? Necrosis. Very good. The succeedingly, it will go to myocardial infarction. Very well that you analyze that, Ken, that for me, personally I have a dilemma. What will I prioritize? Is it pain or ineffective tissue perfusion? No? In the ABC supply, you need to prioritize what? Airway, breathing in. Okay, tissue perfusion is also an aspect of your circulation. That's why we need to prioritize ineffective tissue perfusion, then pain and activity intolerance. Did you get my point? Yes. Now,
regarding that nursing intervention, you said pain, huh? Is it realistic? Huh?
I think the management for me, ma'am, for me, from my perspective, we have numeric pain scale, mild, moderate, and severe.
Oh yeah, I know that.
For that one, ma'am, what's your pain scale? 3/10.
3/10.
It's mild. If it is mild, I think there is no need for you to give medication first for your patient because the personal activity, which was written here, I think is already acceptable. But however, since aspirin is a maintenance of your patient, you will administer aspirin, which also decreases the pain. For me, ma'am, it's achievable.
And actually, the drug of choice for this patient, I think, is nitroglycerin.
In the problem that I created, ma'am, it's actually a post-MI.
Huh?
It's post-MI, post-myocardial infarction.
Post-MI.
Post-myocardial infarction. But if it is an initial myocardial infarction, nitroglycerin is a MONA. We have the morphine, oxygen, nitroglycerin, and aspirin is a drug of choice for this patient.
So for pain, only the aspirin. For pain, only the aspirin. But for me personally, I cannot. It is not realistic.
That's what I'm questioning
And
myself as
there
well.
is also tissue perfusion, oxygenation. It's about oxygenation.